you. Well, it's great to be here and see all of you, and I have to confess that Bill has given me a really difficult task today, so for this, I'm very largely stepping outside of my lane, so if any of you know more about this topic than me, I welcome you to chime in. So the broad idea, and this actually dovetails nicely with what we talked about this morning, is making information matter, and that is important in so many different contexts. It matters when we think about a beverage tax. It matters when we think about trying to explain things outside of academia, people that don't understand the work that we do. But the two examples that I'm going to talk to you about today in terms of making information matter and using that to promote healthy eating are in the context of cooking and the context of the broader environment. So with respect to cooking, there's a lot of literature, as you probably know, around what do we know about cooking, and if you give people lessons around cooking, does it matter? And the answer is pretty much yes. If you sort of show people how to cook, you can increase their confidence, you can change their dietary intake, you can change how they prepare food, and you can change their perceptions around cooking. But there's a lot of barriers to actually doing that. And so for some people, it's actually hard to get them to even go into the kitchen in the first place because that's not part of what they do. They don't enjoy it, or they don't have time for it. Other barriers that we've talked about today relate to sort of physical access. So maybe you just don't live near the stores that sell the things that you want to cook, or maybe you don't simply have the tools like the pots and the pans and everything else, or it simply could be too expensive to buy all the ingredients, and it might be cheaper for your family to actually buy prepared foods. So there are some promising strategies using things like peers from the community to promote issues related to cooking, but there's also a lot of challenges in this area of research. And one big one is sort of the state of the evidence. So this morning, Vasanti was sort of talking about meta-analyses and the challenges of comparing apples with apples and apples and oranges. And this is an area of research where you have a lot of apples and oranges. And the reason why you have lots of apples and oranges is because when people sort of do a quote-unquote cooking evaluation, they mean lots of different things. So they could be using different measures, they could be using different approaches, they could be using different study populations, different follow-up periods, different lengths of time. And for all those reasons, it's hard to sort of make sense of what that literature shows. And another big challenge is that people that tend to enroll in these classes tend to already like cooking. And so you have this big selection bias effect where it's not surprising you see an uptick because you've got people that are primed and excited about cooking. And so I would say that, when it comes to low-income populations and vulnerable groups, cooking is an area where there has been success. It's been demonstrated success. This matters a lot for families in the SNAP program, where the Thrifty Food Plan is based on the idea that you are not buying prepared food, you are soaking beans. And so trying to maximize dollars and helping people learn how to cook and like the things that SNAP-Ed does, it becomes very important, and there are proven models. But doing that in a sustainable way that is consistent with life is the challenge. For some families, it is just not realistic. Someone's going to be cooking every day. So then the questions are, what do you do? And so the other thing that Bill asked me to talk about, switching gears, is what do we know about using information that matters to get people to change behavior? And as Lori said, information on its own is not going to change the world, but it is a useful tool in some cases, and it is also very bipartisan. So the fact that menu labeling was in the Affordable Care Act is largely because giving people information is a bipartisan activity. Sugary beverage taxes are much more partisan, and so it's a different type of fight. And so when we think about menu labeling, there's a lot of work that's been done in this area, even though, as we all have just seen, the implementation has been pushed back. But a lot of that work has asked the question, if you give people information about calories, does it matter? And on my team, what we've really tried to push back on that and say, the average person doesn't really know what calories are. And the average low-income person has both poor nutrition literacy, so they don't really know what calories are, and they've also, like most Americans, they've got poor numeracy. So if you tell them, for example, your bottle of soda has 250 calories, the chance that they're going to take that information and then use that in a meaningful way and modify what they're eating is probably quite slim. And that extends not to just low-income populations, but just to people in general. And we also know that there's more and more research that shows if you just make information matter just a little bit more, you can touch people. And I think in our day and age, and this sort of goes back to the conversation earlier today about media and messaging and how do you actually target things, if we in public health had steady drumbeats around this is what we think about sugary beverage taxes, this is what we think about menu labeling, sort of what the advocacy groups are sort of identifying priority areas and staying on message. From the research side, that doesn't happen, and it doesn't happen by design. But that gray, which is the color of science, creates holes you can drive trucks through and create a lot of opposition. And so I think that as we think about ways to make calorie information matter, there are very simple things that we can do, which we've shown in research to actually be pretty effective. And so the research study, basically the punchline is we went into a bunch of different stores in Baltimore, again, thinking about how do we make kids make better choices around sugary beverages, which we know kids consume too much of, which we know from the morning discussion that increases your risk of diabetes and other CVD health outcomes. And what are some ways we can try to get kids just to make better choices if we just modify their environment a little bit? So this is thinking about the nudge strategies. And so what we did is we went into a bunch of corner stores in Baltimore City. We're targeting predominantly low-income neighborhoods where we've got adolescents who have the highest consumption of sugary beverages, as you all know. And these stores, which are corner stores, so these small, tiny stores, 800 square feet, 400 square feet, they sell a lot of candy and soda, and it's where a lot of kids do their discretionary purchasing. And so the kid would walk into the store, and there are these 4 signs which are randomized on the beverage cases as they're reaching to go and get a drink. And the signs said the exact same piece of information, but they said it in ways that were more meaningful. So one sign, these are all randomized, one sign simply said, did you know your bottle of soda has 250 calories, which is what you would see if you turned that bottle of soda around. The other signs took that 250 calories and just made it make more sense. So it said that, did you know that it's 5 miles of walking, 15 minutes of running, or 16 teaspoons of sugar? Super easy calculations, not hard to do. But the takeaway point was wonderful. And so what we found is that for the average kid who walked into these stores, the level of soda consumption at baseline was 97, soda purchasing was 97%. So you've got nowhere to go but down. So if you look basically at the sample of kids in Baltimore, 97% of beverages being purchased in these corner stores is a sugary beverage. That's a really high number. And by just throwing these signs up, very low cost intervention, we found that kids bought a 14 percentage point difference in sugary beverages, so a lower volume of sugary beverages. They purchase fewer calories from sugary beverages. They purchase smaller actual volume size sugary beverages. This happened right around the time the Bloomberg proposal was up, so we decided to test it. And what was super exciting, which hadn't been tested before, is we took the signs down, let life return to normal, and then we watched the kids again. And what we found is that those exact same behaviors, the buying fewer sodas, buying fewer calories, and buying fewer big sodas, persisted. And so we were really encouraged by that. And you know, the big picture takeaway from this work, which is one small study in one city, which is obviously not generalizable, is there are big levers we can use in policy, which are tricky and hard and gaining traction, like sugary beverage taxes, and have a whole lot of promise, largely at the population level. And then there are these smaller things which we can do, which I think are a lot easier to do on the margins, which don't cost as much, which don't get as much pushback, and you can actually make a difference. And you know, with menu labeling, what we're seeing is only about 20 to maybe 50% of people actually see it. And among those, some minority, some number less than 50% actually make a change. But some people are making a change, and that matters. And even if it's 10 calories or 20 calories or 30 calories, that matters. But the bigger issue is that calories don't really matter that much to people. And so if we know that eventually calories will be in wide release around the country, I think we should be thinking about, when it comes to sugary beverages, when it comes to other items, how do we take that information and just make it matter a little bit more? And if it matters a little bit more, maybe you can shift people a little bit towards a different behavior that's more health promoting.
Thank you, Sara. Questions?
Yeah.
So I was just wondering, in your study, if sales were impacted.
Yeah, good question. So Sandy's question was, in studies, were sales impacted? And this is like the holy grail.
Right.
So we can't answer that question. In fact, one thing we did find, which was interesting, is our working assumption is that you go into a store and you're thirsty, and so you buy something. What we actually found is that pre-post intervention, about 30% of kids walked in and bought nothing post-intervention, suggesting that seeing the signs encouraged them to buy nothing. Now, that's not a good message for stores. And so the business impact studies have not yet been done. What I can say is that the stores let us come back and do it a couple times, so that's encouraging. Some stores wouldn't let us do it because they were worried about this issue. I think that the short-term solution is to offer some sort of stocking release and try to cover up that difference if there is a gap. But I think that there's a growing consumer demand for healthier items, and I think that the concern on the store side is people aren't going to buy it, whereas my argument was, try stocking it, and they just might. And so I think that there's an evidence base that's really missing, and it's important because the number one question always is, great, it works. How much does it cost me? And we can't totally answer that right now. Yeah, Lori.
Oops, let me pull this over here. It's a tidy little study. I really like it, Sara. And so this is just a small comment in honor of Tony Yancey, whose voice we just heard. And the kind of information translation that you're doing is really good, and we call that social math. the idea of taking large numbers and making it meaningful for people. And we were doing it, I don't know if you guys remember when Shrek came out and there was Shrek cereal, and so somebody calculated how many jumping jacks you had to do to burn off a bowl of Shrek cereal, right? And I was using it in a presentation, and Tony came up to me very kindly afterwards. Those of you who knew Tony would recognize this in her. And she just took me aside and said that she'd appreciate it if we didn't make the comparison between the exercise and the drink, so the walking 5 miles. And her rationale was that it narrowed the value of physical activity and equated physical activity just with losing weight. So in honor of that, I've tried not to do that, and I decided to say so here because we just heard Tony's voice. So the comparison with the sugars, she'd be all over that. And so what we did in some of the soda work when we were doing talking points and such is compare drinking soda to eating a piece of cake and things like that. So it's just a little thing. I love the study, but I wanted to bring Tony in the room for that.
Yeah, it's an interesting point, and it's something, so we thought a lot about this on the front end. We sort of said, well, we don't really know what activity is going to matter most. These were Black adolescents that we were targeting, and so we sat down and talked to them, and we sort of said, is it basketball, is it yoga, is it stair climbing, is it something else? And the things that resonated most, the things that people understood, were walking 5 miles, because there's a 1 mile fitness test you have to do in Maryland to get out of high school. And then also the running, and likely because it's negative stuff, and they know what that means. They know how hard it is, but they sort of enjoy basketball, and they enjoy yoga, and they enjoy lacrosse and other things. So I definitely appreciate that point. But for me, what it goes back to is if I'm trying to change X person's behavior, and they're telling me that this is going to resonate with them, then shame on me if I don't meet them where they are. And I think that's the real challenge.